We turn now to the global health crisis caused by the outbreak of the coronavirus. More than 86,000 people have contracted the illness, most in mainland China. But 59 nations now have confirmed cases, including the first death here in the U.S. President Trump says there's no need to panic. Joining us with the latest, Secretary of Health and Human Services, Alex Azar. Mr. Secretary, welcome to Fox News Sunday.
Good to be with you, Chris. Thank you.
What's the latest count of coronavirus cases in the U.S. of unknown origin, where at this point the only explanation is community spread?
You bet. So we've got 23 cases here in the United States that are not a result of us repatriating individuals from Japan or China. Of those individuals, we've got cases in Chicago as well as Washington and Oregon, and 2 in California, where we do not yet know why they contracted the novel coronavirus. So we're deployed with state and local people, and we're working to get to the bottom of it.
So we knew about the cases on the West Coast. There's now one in Chicago as well?
There is one overnight in Chicago, yes.
And did the man who died from the illness in Washington State, did he get it, best of your knowledge, from community spread? And what can you tell us about this nursing home in Kirkland, Washington?
So at this point, we do not know how this gentleman contracted the illness, and we're obviously want to express our sympathies to him and on behalf of him and his family for this fatality. He was in a hospital. This hospital is one where the nursing home sends patients. There are cases in that nursing home also. So right now there's a large investigation going on. The nursing home, the hospital, contact tracing to try to determine where that disease was introduced and how it might have spread.
But you don't know. So at this point, this is a community transmission, which means it's somewhere out in that community in Kirkland, Washington.
At this point, it's a suspected community transmission, yes.
And that's concerning, right?
Any community transmission is concerning. That's why we've been very clear from the outset. We're going to have more cases here in the United States in spite of the president's aggressive efforts at containment. We'll see more cases. We'll see some forms of community spreading, but the risk to any individual American remains low. Thanks to the efforts the president's taken, they stay low. We're working to keep it that way, but things can change rapidly. They should know we have the best public health system in the world, though, looking out for them.
Let's talk about some of the new measures the president is considering. He announced a travel advisory yesterday to South Korea, parts of South Korea and Italy. What would it take to go to a travel ban, and how seriously is he considering shutting down our southern border with Mexico?
Well, right now Mexico has very few cases, so that would take a real change in the epidemiological profile and the risk to the United States from there. I think what he was trying to say is all things are on the table. We're not going to take anything off the table in our armamentarium of tools we have to protect the American people. So what he announced yesterday is we already had level 3 travel warnings for all of Italy and all of South Korea. That means essential travel only is recommended. But for the impacted areas in northern Italy and the one region of South Korea, we escalated that from the State Department to a level 4 advisory, which says do not go to these parts of Italy and to South Korea.
And is there a point at which you could go to a travel ban?
We could look at using 212F, which is the procedure we've used for China, where we actually restrict entry from certain countries. The point is, with Italy and South Korea, we have highly developed public health and healthcare systems. We have transparent leadership and very aggressive action that's been on it from day one. So at this point, we think advising people not to go is the right measure, but everything will always be on the table.
What about, there's talk of invoking war powers to require U.S. companies to manufacture some goods in the national interest. One possibly, I know you have millions of them, but one is that you might actually require companies to manufacture more protective masks.
That's right. So that's called the Defense Production Act. I believe it came into existence during the Korean War. It's actually used fairly commonly for Defense Department procurements here in the United States. Effectively, we can determine that our production should get to the front of the line, and so we go before any other contracts
So where are you on doing that?
So right now we are initiating the procurement processes for personal protective equipment, so that would be masks as well as gowns, gloves, etc. We've got that process initiated. We're gathering information from potential vendors.
But is that going to be under the War Powers Act that you're going to?
If we need to. We'll use it if we need to, but we obviously, if we can work cooperatively with any vendor, we'd rather do that. But we're waiting for the emergency supplemental funding from Congress because, of course, we need that money to fully fund those procurements.
One concern that some Americans have is that President Trump and some of his advisors are lowballing the risk from the coronavirus for political purposes. Here's one example.
Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
I think this virus is probably with us beyond this season or beyond this year, and I think eventually the virus will find a foothold and we will get community-based transmission.
Do you know that the coronavirus is going to disappear in April when the weather gets warmer?
No, we don't know that. The normal coronavirus, the annual cold, and as well as flu and other respiratory illnesses, often do dissipate and go away in warmer seasons. The virus just doesn't survive well in a warmer climate, warmer atmosphere. But we do not know as to this novel coronavirus how it will interact. The SARS, for instance, which was a novel coronavirus, did not dissipate in April. What the president's been saying is we hope that it will be like the regular cold or regular flu and dissipate, but we do not know.
But here's another example of what some people are calling lowballing by the president. Take a look.
Because of all we've done, the risk to the American people remains very low.
It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will have severe illness.
Well, since Dr. Messonnier spoke, we have begun to see community transmission. We have seen severe illnesses. We have seen at least one death. Can you understand the concern about mixed messages coming from the administration?
I can understand the concern, but I hope people will understand what we're trying to do. We're trying to level with the American people at all times. So Dr. Messonnier was very clear with accurate information. The risk is low. It remains low, but we have always expected we would see more transmission. And as she predicted, we will see at least some limited community transmission. The president, though, is also trying to keep balance in messaging so that the American people don't engage in unwarranted panic. For instance, people running out and buying face masks. That's not needed. That's not indicated. We don't recommend it. It actually can be harmful to individuals in an infection situation. So he's trying to keep good balance. I'm trying to keep good balance, but we're also trying to be radically transparent with our information to make sure folks know what might be coming so they can mentally prepare as well as engage in normal preparedness activities.
I want to pick up on that with you because clearly part of public health is psychology. And in the last week, we saw the Dow Jones go down 3,500 points. We see people buying masks, hoarding food and other supplies. Obviously, part of this is a reasonable response to an unknown threat. But do you see some elements of panic?
I see elements of uncertainty. I was with Secretary Mnuchin yesterday at our task force meeting at the White House, and he was talking about the stock market reaction and how so much of the market is just dealing with uncertainty. And we're dealing with a novel virus, and so there is uncertainty. And I know that can make people feel uncomfortable, and that's why we are trying to give the American people all the information we have when we have it, so they don't think there's secret information they're not getting. That at least helps. We say what uncertainties we've got, and as we resolve them, we try to clarify.
People are overreacting?
Yes, absolutely. If people going out and buying face masks, that's not necessary. In fact, we need those masks for the people who should be using them, which are healthcare workers taking care of patients.
Finally, a whistleblower in your department raised a concern about a number, I think a dozen HHS workers who were apparently sent to receive the first evacuees from China, she says, without proper gear, without proper training, and she raised this concern. I know you say you're investigating, but that woman, was she reassigned, as she claims, after she raised this concern?
So first, it is vitally important that we protect our employees in any situation. It is vitally important that we follow the appropriate isolation or quarantine protocols in dealing with individuals. And it's important that no whistleblower ever be retaliated against, and we will never permit retaliation against a whistleblower. Let me give you the facts that we know so far. First, Every HHS employee who was involved in the allegations in the whistleblower's complaint has now been well over 14 days from any interaction with individuals, and nobody is symptomatic or has the disease. So there was no risk. There's no risk to the people of HHS, no risk to the community, even if the allegations prove to be true. So that's a very important fact. We also have offered voluntary testing to our employees. It's not medically indicated because they don't have the virus, but if it comforts them, we're going to get them tested so they know.
But what happened to the woman? Was she reassigned? She had said more than 10 days ago that she was reassigned. You certainly know whether that happened.
Well, I'm not going to discuss personnel matters. That wouldn't be proper for me to do, but there will be no retaliation against this individual or any other individual. We are grateful. If our employees raise concerns about our processes, if something proves not to be right, we are grateful for that.
So if she was reassigned, I know you can't discuss it. If she was reassigned because of raising this complaint, you're saying she'll be restored to the position?
Nobody would ever be reassigned or discriminated against or prejudiced or retaliated against because of raising concerns about the functioning of the department.
And you can't tell me whether that happened?
I'm not going to tell you whether that happened because that's still under investigation. We are doing a comprehensive, thorough investigation.
Secretary Azar, thank you. Thanks for coming in today, and we'll, of course, be tracking your efforts and the efforts of the entire task force to follow and fight this disease in the week ahead.
Thank you, Chris.